Good afternoon. Welcome to the 3 o'clock news at Imperial College. You're here with Nonyelum Ojukwu. Today's top story is 40-year-old Darren McLeod, who has been denied gastric bypass operation on the NHS, as his doctors claim he is not heavy enough to meet the criteria to have this life-saving operation. We're speaking with him today. Good afternoon, Mr. McLeod.
Hey up, Nonny.
Thank you very much for calling today. Could you tell us what has happened, please?
I've always been a bit of a big boy. I've been trying to lose some weight for quite some time now, and I've been looking for a quick solution. And I heard about it the other day. It's called gastric banding, and it's free on the NHS. So I went down to my doctors and asked if I could get it, and they said I just weren't heavy enough to meet the criteria. It doesn't make any sense. I mean, I pay taxes like everyone else. I should get the same kind of treatment. It just doesn't make sense.
But Mr. McLeod, are you aware that some argue that 20 stone in weight does not warrant surgery, but rather a lifestyle adjustment, perhaps more regular exercise and diet adjustment? I mean, how do you feel about this? And have you tried alternative methods in the past to lose weight?
Yeah, well, I'd say to those guys that they haven't really lived in my shoes and got to know what it's like. I mean, once you get to this kind of weight, I've tried dieting and Weight Watchers and exercise, but it just doesn't really work. Exercise for once, as soon as I try a bit, I'll get all huffy and puffy. It's just not happening really. Oh yeah.
Oh, I do apologise, Mr. McLeod, but there seems to be some disturbances.
Oh, well, don't worry your pretty face about that. It's just me digging into some crisp, really. Ever since I've been told to get my BMI up to 45, I've been trying to scoff my face with sandwiches and crisps. I feel a bit bad for my mum, actually. She's always having to cook and clean up after me. I feel like a bit of a burden. I'm worried that I might not be able to live much longer, but hopefully the surgery should let me live longer and better. All my friends are always asking who ate all the pies, and for once, it's me. I've been eating all the pies.
We'd like to thank you very much for calling, Mr. McLeod.
Well, hold on, you don't need to be so quick.
I do hope that...
Oh, well, I haven't spoken to Gurn in a long, long time.
Thank you very much for your call.
Alright, well, just give us a ring back a little later on. My number's 07912 502.
Hospital admissions for obesity have risen by almost 60% in 2010. Weight loss surgeries have also rose by a staggering 55% in just 12 months. A study conducted across 10 PCTs in England showed a clear increase in the number of bariatric procedures conducted over the period from 2006 to 2007 to 2009 to 2010. The number of discharges has also been used as a proxy for the number of surgical procedures conducted within each time period. Under NHS guidelines, not everyone qualifies for weight loss surgery. Candidates must be morbidly obese or have other health problems such as type 2 diabetes and heart disease. Surgery is often seen as the last resort for those who have failed to lose weight via conventional methods such as diet and exercise. The increasing demand for bariatric surgery has put huge pressure on the NHS, but with budget cuts in place, can the NHS really afford to provide weight loss surgery for all? Today we'll be looking more at these issues. Over to our news reporter Min.
I'm outside St Thomas's Hospital now to meet Dr. Jessel, who is a consultant bariatric surgeon. Dr. Jessel, what is the problem with obesity?
Well, I feel that there's a growing trend which really does need to be addressed considering the provision of bariatric surgery. We need to consider what's truly important and focus our efforts on prevention rather than looking at expensive new treatment. And in my opinion, there's 3 clear routes that we need to take when tackling obesity. First one that's very publicised is that of surgery. Secondly, medication. And one that's commonly neglected, which I feel is the most important, is through lifestyle intervention.
Then what are the costs related and why don't people take the private route with this?
Surgical intervention can be extremely costly, time and resource intensive. There are very few facilities and skilled surgeons available to deal with the increase in demand for such operations, and as a result, prices are poorly regulated and can cost upwards of £12,000 for each procedure. Obviously, the NHS can't compete and justify these prices, hence selection criteria are extremely stringent. So patients must meet a certain BMI, they must have taken a certain amount of medication before this. So obviously, only certain patients can be selected. But with private care, this isn't the case because patients elect the treatment and they can choose to take this treatment at any time should they want to. However, what they're not aware of is the unnecessary risks of being exposed to surgery at an earlier than intended time.
Well, what are the advantages of providing the surgery at earlier stages?
Okay, well, obviously we need to consider these benefits as this is something that's becoming very popular and patients want to know. From the patient's perspective, surgical options can seem radical and yield rapid results, and the provision of medication has been incorrectly perceived as a weaker way of tackling obesity. So I suppose surgical interventions can reduce the strain or burden from the NHS, as there are many associated conditions such as diabetes or cardiovascular disease that occur in conjunction with obesity. And currently, I'm sure it's been well publicised, but the cost of all of these, including the cost of obesity in general, has exceeded well over 4.3 billion, and this is money that we can be using elsewhere within the NHS.
Thank you, Doctor. That was Doctor's opinion, but what do you policymakers think? I was able to catch up with Health Minister Lord Anushka in Westminster. So, Minister, should the NHS provide gastric banding free for all?
Well, it's of course up to individual trusts to commission a range of services to meet the local needs of the people, but bariatric surgery should always be the last resort.
Then who would you say is responsible for this?
Well, responsibility lies with the individual. We should encourage people to pursue a healthier lifestyle, so this type of treatment isn't necessary in the first place. This is a case in point of the need to stop problems before they arise. Such a proposal would have negative consequences for society as a whole. And once you start here, where would we stop? Surgery is not a substitute for a healthy diet.
But would you say the NHS has a much more right to care for everyone?
Well, the NHS is one of our great national institutions. It's our duty to ensure that it provides the best possible care for the greatest number of people. This means, especially in such economically turbulent times such as these days, we must allocate resources efficiently. It would be a moral hazard to bail out a certain section of the population who behave in a responsible manner and not take care of their own health.
Well, could you not save money by reducing excessive salaries of certain doctors and perhaps like ministers like yourself?
Well, I hesitate to accuse you of ignoratio elenchi. I mean, you yourself have paid a great deal of money by ICN, the quantity of which we are yet to discover. But let's be absolutely clear about this issue. After all, are the policies that... Sorry, what was the question again?
Thank you very much, Minister. So back to the studio.
Thank you very much, Min. So in summary, surgical interventions to tackle obesity have high costs involved due to the rising demand and the lack of facilities. The early provision of surgery does, however, reduce the financial burden on the NHS. More updates next time. You're watching IC News Today. Thank you for watching. Good night.